Hi, everyone. Welcome back to the XCEL podcast. We have a great guest today, Jailynn Francisco. Thanks for coming on.
Thanks.
We've only been trying to do this for 4 or 5 months now?
It's been a while.
We finally are getting around to it. We both are a little nervous. We're in a new place, our new location in Hannibal. We have not done this together, so we're going to figure this out. And my biggest thing that I wanted to bring today was to introduce you to all the people who listen to us, all 2 listeners that we have, and really let people get to know you a little bit better. You've been here in the community for a long time.
Yep.
Not only just as a resident, but also as a physical therapist. And I think that's actually where I'd kind of like to start off, if you're okay with that, is tell people a little bit about yourself. You're a mom, you're a wife, you got kids here in the community, obviously, and tell us a little bit about how you got into PT as well.
Okay. So I was born and raised here in Hannibal. Came back here after PT school. I have 3 children. Aubrey is 11, she's in 6th grade, and then my boys just started kindergarten this year, they're 5.
Twins.
Yeah.
I don't know
Fun
how you
times.
did it.
Fun times. Some days me either.
Yeah.
But yeah, as far as PT, I knew I wanted to be in healthcare. Wasn't really for sure what exactly, and then I had a job opportunity come up where I was a rehab tech.
Okay.
And just seeing things there kind of sparked my interest in physical therapy and went from there.
It's interesting. I feel like most people that I know had some kind of experience, not to project, but that's how I got into it. Was I was injured and I was the patient, right? And I was going through my shoulder rehab, and I was intrigued by what I saw. So I first went into athletic training. That was kind of like rehab tech. There's like a door that opens for you, and I had a mentor that helped me through that phase of my life. But then I knew that there was another level there as well in terms of the rehab side of it. So it sounds like you had a similar. Yeah. Where'd you go to school again?
Mizzou.
Yeah.
So I did my undergrad there, and then also PT school as well.
MIZ.
ZOU.
So how many years have you been a PT?
Let's see, 14 years.
Okay. Yeah.
Long time.
Dating yourself, yeah.
Right, I know. It goes by fast.
How has it changed, or has it changed at all? And if it has, how has it changed?
Oh gosh.
Good and bad, right?
Yeah, good and bad. I mean, I think just personally it's changed just as far as, getting out there and learning myself and being more confident in some of the skills. But I think also too, insurance is really driving what we do, and it takes away a little bit from the patient care. So the struggle is finding that balance and finding a spot where you can, do what you need to do to help those people get better and get them back to where they want to be. So.
Mm-hmm. Yeah, that's also. I've been a PT now for 10 years, so just right behind it. And I think that's also been the biggest thing that I've seen that's been different, or that's changed, is there's practices now that are all cash based. Can you imagine that? Or maybe there's a hybrid model, some insurance, some cash, but insurance companies dictate, to your point, a lot of. I'm seeing now where we'll get maybe 6 visits approved, and then we have to go get more approved after that, right, with further documentation. And so it's not all for the better, is what you're saying.
Right.
But what has gotten better, in your opinion? I see apps and Twitter and things. I can learn a lot more quickly without having to pay Mizzou $30,000 a year to go get a degree. Not that that's not valuable, it is, but have you seen that too? Do you dive into any specific areas?
I don't, being a mom, it's a little busy and hectic. Easy. I feel like I'm starting to get into some of those things outside of just your regular continuing ed kind of a thing, but no, there's not one specifically I follow or anything like that.
I think that's a cool thing that we're actually, and even something like this, we're able to bring more content, more education to people, but we gotta actually do it right. Not wait 4 or 5 months to do it. In your opinion, if you had somebody walk through the door right now and you're thinking in your head, okay, I can really help them. What's kind of like an ideal patient for you? Something that you're really, really confident. Is it somebody who's had a total knee replacement? Is it somebody who is post-surgical? I know you're learning more about pelvic floor dysfunctions and things like that, but what would you say is different for you?
I do enjoy post-surgical patients, But I think too, like I enjoy working with people who have Parkinson's or Parkinsonism disorders, using like the LSVT Big to try to help them become more functional and the women's health stuff. So diving into that, and hopefully we'll start seeing a few patients with that as well.
Those are all needed things, and I think those are some areas that people don't always want to discuss, right? Like those are tough subjects to bring out, and how, in your opinion, and how has it been? How has your career changed over the last 14 years? You've been in multiple settings. I mean, right now you're in an outpatient setting, but you've been in a nursing home. But what all settings have you been in?
So the acute care setting, and then we also had an inpatient rehab facility there. So I've touched a little bit in both of those, and then I still do nursing home stuff now. So kind of hit them all, except for pediatrics, I guess. But
and let me ask this. So let's say we were sitting here a year, 3 years, 5 years from now. Now that'll be 5 years from now, it'll be 19 years as a PT. Where do you see us going as a profession? And this is a tough question. I'm not even sure if I could answer this. It's just again, this is real, this is raw. But we know that one of the problems we have in PT is there's kind of a mass exodus, right? Because of some of the things you mentioned, the insurance and the documentation and the time. Where do you think we're going as a profession? If you had to guess, if you had a crystal ball, where do you think we have to go?
Man.
Tough question.
Tough question. I don't know. I mean, I think just our services need to be more readily available to everyone, because I feel like there are a lot of restrictions, and then people are like, I don't have coverage for therapy, or maybe they don't even know about it, or aren't discussing that with their physician. Just knowing what services they do have available.
Do you feel like there's times when PT kind of gets a bad rap? I remember one of my good friends, his dad was a truck driver, and he needed therapy for his back, PT, and went to a company and just did not have a great experience. And I always hate to hear that, even if it's like a competitor. Like I hate to, because it's still our profession. Like PT needs to be out there more, because the evidence behind a lot of what we do is better than the evidence that's out there for other interventions, such as narcotics or medications or even surgical interventions. Not to badmouth that, it's part of the game, but I feel like if I had to answer my own question, we need PT to get out there more and be more exposed, which is why I think these kinds of things are so important. So I'm hopeful we can do that with this. This took some courage from you, so I do appreciate you doing this. Jailynn will be back.
Oh boy.
She signed a contract for 10 episodes a year. No. Just kidding. But I think hopefully we've, at least on the first level, been able to accomplish what I was hoping to, which is I want people to know who you are, how you can help them, where you're at. You're here in Hannibal, 6466 Interstate Court, Hannibal, Missouri. Don't know the zip, but it's something like that. And opened up in May, and you and Robbie have both really driven this place to a good spot. I told you right before we hit the record button, I'm ecstatic with where we're at. We've got the right people, the right culture, the right environment. I think we're doing, for the most part, a pretty good job. So I'm thankful for Jailynn, thankful that she's here. Any closing comments for you?
I don't think so.
Thanks for joining us.